Hi, I'm Lisa from First Class Medical. We're here today to talk about IPF. September is IPF Awareness Month. IPF stands for Idiopathic Pulmonary Fibrosis. Idiopathic means that we don't know the cause of it specifically. Pulmonary means a disease that affects the lungs, and fibrosis means scarring. It falls under the umbrella of the interstitial lung diseases. The interstitium is the tissue between the lung sacs that are the part of the elasticity of the lungs. So as that tissue gets scarred and thickened and stiffened, your lungs just can't expand the way they used to, so you can't inhale as much. As of right now, there's no cure, but there are medications and treatments that can be administered to slow progression as well as improve quality of life. So right now, there are very few drugs that are available. There's about 100,000 cases of IPF in the U.S. right now, and the FDA has approved only a few drugs for that. There's Ofev and Esbriet, which you may have heard of. They are effective in treating some of the symptoms of IPF. But there are some side effects, which I'm sure your doctor will go over with you. There's some liver function issues and possibly some photosensitivity issues that if you live somewhere like we do in Colorado and it's sunshine all the time, you might have some photosensitivity problems. One of the things that can improve greatly the quality of life for people with IPF is medical oxygen. And a lot of people when they first get prescribed medical oxygen, unfortunately they're given tanks, which depending on what setting you're on, can only last for so long. So, if you're out for all day long, you might have to take 3 or 4 tanks, and they're heavy tanks. You got to drag them around the trunk of your car and things like that. So it's not ideal, but it's either that or you're housebound. So something like this, our portable oxygen concentrators can be life-changing for somebody with IPF. Most IPF patients need medical oxygen when they're active during the day, and they can be on a pulse flow when they're out just running errands, or if they're out doing their exercises, walking the dog, or working around the house, they can be on a pulse flow. And at night, because when you lay down, it often impedes your lung function as well, they have to be on a CPAP or a BiPAP, so they need a continuous flow concentrator in the evening, at night when they're sleeping. So during the day, if you have something like this is the Zeno. It's made by GCE. It only weighs 10 pounds, and it has a cart, so you don't have to carry it around. And it goes from 1 to 6 on pulse flow, but also it goes to a 2 on a continuous. So if you have a BiPAP, CPAP, anything like that, this is going to work for you in the evening as well. The SimplyGo, this is one of the longest produced concentrators on the market. It's made by Respironics. It also goes up to a 2, and it goes to 1 to 6 on pulse. It also comes with a cart. The battery life, you can be out of the house for pretty much all day. If you have 2 batteries, you can take all day long. And if you're just on pulse during the day, when you're driving from place to place, you can plug each one of these into the DC power supply, and it'll charge your battery as you go on pulse. If you need something a little higher than 6, you might be looking at something like this, which is the Oxlife Independence. And some people get intimidated by the size of this machine. It is definitely a little heavier. It's 19 pounds, but it comes with this travel cart, and you just put up the handle like this, and this is one of the most agile travel carts there are. And it's attached here, so you just press this in, put the handle down, so it's easy to get in and out of the car, or if you're traveling, going on an airplane or something like that, it goes right under the seat. It can still work with that. The best part about having one of these is you can still feel free to travel. You can go in the car, you can go on the plane. You're not going to be bound by any tanks. They don't even let tanks on airplanes anymore because it's a safety issue. They're not illegal in cars, but it is unsafe in a car. If you get in an accident and you've got tanks in the trunk, you might have a problem. So you might want to consider one of these so you can sort of have more freedom, more independence, and just live the life that you're more used to living if you have IPF. IPF is one of the most misdiagnosed and underdiagnosed conditions that there are, because it mimics a lot of other conditions, and it's not as prevalent. For instance, I said that about 100,000 people have IPF in this country versus 13 million people have COPD. So your doctor is much more used to seeing somebody with COPD than IPF. IPF is a restrictive disease because it's the tissues that are restricting the lungs, whereas COPD is an obstruction disease where the actual your airways are actually obstructed. So the treatments are not going to be the same. So to help you maybe talk to your doctor a little bit about this, if you've gotten diagnosed with COPD, you've gotten diagnosed with pneumonia, asthma, or anything like that, and any of the treatments that they're giving you are not working, it might be because you have IPF or some other disease. And so if you feel like the treatments aren't working, we made a guide that you can download for free. You can go through the symptoms, what you're experiencing, and go through the medical history. If anybody in your family's been diagnosed with any sort of respiratory disease, this is a genetic disease as well. And even though we don't know the cause, there are risk factors involved. Smoking, like any other respiratory disease, smoking is a risk factor. If you've worked in an industry where there's, in a sawmill or, in a mine or anywhere where there's a lot of particulates in the air, that's also a risk factor. So you can talk to your doctor about that. And if you've been diagnosed with something that the treatments aren't working, don't be afraid to advocate for yourself. These treatments are much, much more effective the earlier you catch the disease. So if we can answer any questions for you, you can give us a call at
1-800-946-1201.
Our respiratory specialists have helped a lot of people with IPF, COPD, and they can answer any questions about your oxygen needs. If you have a vacation coming up, or you're anxious about the holidays or anything coming up, we can answer any questions for you. Thank you for watching.